Hi, everyone. My name is Tanner Johnson. I'm the current PGY2 infectious diseases resident here at the University of Colorado Hospital. We're very excited that you're interested in our program. So just wanted to give you some quick background information about our program and some perspectives as the current infectious disease resident. I want to start off with just talking about some of the amazing preceptors that we have as part of our program. So far, we have 11 formal preceptors for the program that are really specialists in a variety of different areas. We have multiple different preceptors that are infectious disease trained. We also have a variety of specialists specialize in HIV, hepatitis C, bone marrow transplant, solid organ transplant, as well as orthopedic infectious disease. So you really get a variety of experiences, not only with our rotations, but also with a variety of different preceptors. And these preceptors truly are specialists in their own individual areas. So when you come here, you really are learning from the best. Additionally, several of the preceptors that we have here as part of the program actually completed their PGY1 or even their PGY2 infectious disease residency as part of the University of Colorado training programs. So I think that's just a testament that really shows how great of a place this is to train when you know that people are willing to stay on afterwards for their careers. The next topic I wanted to talk about is the staffing requirements and staffing components of our residency program. The staffing requirements that we have are approximately once a month, so every 4 weeks or so, and are predominantly internal medicine for clinical pharmacist staffing positions. These are primarily on the general internal medicine floors, with also opportunities to train on the orthopedic floors as well as the solid organ transplant floors, which I think are both great experiences to get additional experience with our orthopedic infectious disease as well as our transplant infectious disease providers. In terms of our day-to-day stewardship activities that go along with your different clinical rotation programs, most of our day-to-day stewardship activities focus on blood culture management as well as MRSA nasal PCR monitoring and antibiotic de-escalation. Additionally, within our electronic healthcare record, we're able to run various reports. And the reports that we run within the electronic healthcare record are namely what we call bug-drug mismatches, broad-spectrum antimicrobial agents, as well as high-dollar medications. And these are things that we monitor on a day-to-day basis to not only assess for appropriateness of antibiotic therapy, but also assess for opportunities for antibiotic de-escalation and cost savings initiatives. Lastly, you'll have the opportunity to carry our antibiotic approval pager, where you'll receive several questions from a variety of different practitioners seeking approval for broad spectrum or high dollar medications. So you'll get to use your clinical judgment on whether or not medications are appropriate and have the opportunity to recommend alternatives in certain scenarios if those may be more appropriate than the restricted antimicrobial that is being requested. In my opinion, one of the main strengths of the PGY2 infectious disease program at the University of Colorado is the research component. And what you'll find very quickly is that opportunities for research are more than abundant. During this year, I am involved as the primary investigator on 4 different research projects. So as much as you want to get involved with here during your time as a PGY2, you'll have more than enough opportunities. Just as some examples of the projects that I'm working on throughout the year, one of my projects is looking at vancomycin loading doses and whether or not those are appropriate in the hospitalized patient population. And really looking at different subgroup analyses to see which patients may or may not benefit from receiving loading doses of vancomycin for MRSA bacteremias. My second project is looking at rifampin use in prosthetic joint infection. My third project is looking at tadalid usage, mainly tadalid safety in the hematopoietic stem cell transplant patient population. And lastly, my fourth project is looking at an evaluation of a new sepsis alert protocol that we recently implemented in part of our emergency departments throughout the UC Health system. So assessing both safety and efficacy of that newly implemented sepsis alert protocol. Outside of the residency program, the Denver area is a fantastic area to live, and really you'll never get bored. As a big city, it has all the food amenities, a variety of different things that really anything that you could think of, and also has a very good craft beer scene if that's what you're into. With Denver also being a big, very large city, does have a variety of professional sports. So we have professional baseball, basketball, football, hockey, so on and so forth. If you're into sports, we definitely have a variety of opportunities to attend live sporting events. And additionally, and this cannot be overstated, a variety of different mountain activities. Here in Denver, we're only about an hour and a half away from Rocky Mountain National Park, as well as about an hour and a half to 2 hours away from a variety of different ski resorts. So whether it be summer or winter, there's really a variety of different things that you can do to get out and about, especially if you're an outdoorsy individual, a variety of different things to do out in the mountains that are very close to town. With that, those are kind of the main things that I wanted to review as the current PGY2 infectious disease resident, and kind of some of my perspectives so far throughout the residency year. If you have questions or clarifications or really anything that I can help with throughout the application process, please feel free to reach out to me. My email address is tanner.johnson@uchealth.org. And if there's anything that I can help with throughout this process, like I said, please feel free to reach out. And very excited that you're interested in our program, and wish you the best of luck throughout the application process.